Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, personalized treatment for endometrial cancer. Sounds pretty futuristic, right? Like something out of a sci-fi movie.
It does, doesn't it? But the reality is, we're getting closer to that future every day.
And this new research we're diving into today, this is a pretty big step in that direction. Right?
Yeah, it really is. We're talking about using a simple blood test.
A blood test to figure out the best way to treat endometrial cancer.
Exactly. By looking at certain proteins in the blood, we can potentially predict how someone will respond to specific treatments.
So, no more guesswork. No more trying one treatment then another, hoping something sticks.
That's the goal. Imagine a world where we can tailor treatments to each individual, making sure they get the most effective approach with the fewest side effects.
That would be incredible, especially for something as common as endometrial cancer, right?
Yeah.
I have to admit, I was surprised to learn it's the most common gynecologic cancer in the United States.
A lot of people don't realize that tens of thousands of women are diagnosed every year. So finding better treatment options is crucial.
Absolutely. And this study we're talking about today, it focused on patients with recurrent endometrial cancer, right?
Yeah.
So those who had already undergone chemotherapy.
Right. The study looked at 75 patients. Some of them received a drug called nivolumab.
Nivolumab, that's a type of immunotherapy, right?
Yeah, it basically helps the body's own immune system fight the cancer.
And the others, did they receive something different?
The other patients got nivolumab in combination with a drug called cabozantinib.
Cabozantinib. Now, that one's designed to cut off the tumor's blood supply, right?
You got it. It starves the tumor by blocking the growth of new blood vessels.
So the researchers were basically testing this combination to see if it was more effective than nivolumab alone.
Exactly. And they were also looking for ways to predict which patients would benefit most from it.
And that's where these blood proteins, the biomarkers, come in. They're like little clues, right? Telling us how a patient's body might react to the treatment.
Think of it that way. And they found some interesting things. Patients with lower levels of certain proteins, ones related to white blood cells called macrophages.
Macrophages, okay.
Those patients actually had better responses to the combination treatment.
So their immune systems were already in a good position to fight the cancer.
Right. But on the flip side, patients with higher levels of certain proteins related to another type of white blood cell called neutrophils.
Oh, neutrophils. Got it.
Those patients were more likely to experience side effects from the treatment.
Interesting. So potentially, this blood test could not only tell us how well someone might respond to the treatment, but also whether they're likely to have bad side effects.
That's the idea. We could tailor treatment plans from the very beginning, making them safer and more effective.
That's incredible. It sounds like we're really on the cusp of something big here.
We are, but as with any new research, there are still some hurdles to overcome.
Of course. Like what?
Well, we need more studies to confirm these findings.
We need larger studies, right? With more patients from diverse backgrounds.
Exactly, to make sure these biomarkers are reliable predictors for everyone.
So this is just the first step. A very promising one, but a first step nonetheless. And I think it's important to hear what the experts are saying about it.
Well, the lead researcher, Dr. Sacek Genetic, he emphasized that this isn't about finding a magic bullet.
It's about something bigger.
Yeah, it's about understanding the complex relationship between the immune system and cancer, how they interact, how they influence each other.
So it's like we're piecing together a giant puzzle.
Exactly. And these biomarkers are giving us a few more pieces to work with.
Helping us see the bigger picture. So it's not just about killing cancer cells, it's about understanding how to help the body fight back more effectively.
That's what personalized medicine is all about. You know, one thing that really jumps out at me from this research is what it could mean for people who have already tried other treatments.
Right, those patients who maybe haven't had success with other options.
Yeah, exactly. For those folks discovering that this combination therapy could actually help their immune system start fighting the cancer again.
It's almost like a reset button.
Kind of, yeah. Imagine your body had basically given up and then suddenly it's back in the fight.
Talk about a glimmer of hope.
A huge one, but we do have to remember this is just one study, and we need to see these results again in larger groups of patients, more diverse groups too.
Right, science takes time, and this is just one step in a long process.
It is, and there are always limitations to any study.
Yeah.
Well, for example, everyone in this study had recurrent endometrial cancer.
So we don't know for sure if these biomarkers would be as useful for predicting treatment success in people who are newly diagnosed.
Exactly right. That's a question for future research.
We need to see if these findings hold true across different stages of the disease.
We do. And even if these biomarkers do turn out to be reliable predictors, there's still the question of access.
Because these new treatments, they're not going to be cheap, are they?
That's a real concern and a real challenge we have to make sure that cost doesn't become a barrier.
Everyone deserves the chance to benefit from these advances, no matter what their financial situation is.
Absolutely. Access to quality healthcare shouldn't depend on your bank account.
So this study is a big step forward, but it also raises some important questions about making sure everyone can benefit.
Yeah, for sure. And, another thing that I found really interesting about this research is the potential for these biomarkers to not only predict treatment response, but also...
The side effects.
Yes, exactly. Imagine being able to tell a patient, look, this treatment has a high chance of working for you. And we can also minimize the chances of you having a rough time with side effects.
That would be amazing, being able to improve someone's quality of life while they're going through cancer treatment.
It would. And think about it. If patients have fewer side effects, they're more likely to stick with their treatment plan.
Which means a better chance of beating the cancer.
Precisely. It's a win-win situation. This research shows us how important it is to treat the whole person.
Not just the disease.
Exactly. Their physical well-being, but also their emotional and psychological well-being.
Because everyone's journey is different.
It is. And it's about having open communication between doctors and patients, too.
Right. Patients should feel like they can ask questions and talk about their concerns and be a part of the decision-making process.
Absolutely. It's a partnership, a collaboration.
So as we're thinking about all of this deep dive into personalized treatment for endometrial cancer, this study focused on biomarkers found in the blood.
Right.
But what about other sources of information?
Like, what do you mean?
Like, what about the tumors themselves?
Oh, that's a good point. Tumors can tell us a lot about the disease.
Right now, we rely on biopsies to get that information. But they can be invasive and sometimes risky.
Right.
What if there were non-invasive ways to monitor tumors?
To track their growth, see how they're responding to treatment, catch any recurrence early on.
Imagine the possibilities.
It would be a game changer.
And there's already some really interesting research happening in this area.
Oh, yeah. Like what?
Have you heard of liquid biopsies?
Liquid biopsies? I don't think so. Tell me more.
It's a pretty new field. But the idea is that tiny fragments of tumor DNA actually circulate in the bloodstream.
So you could learn about the tumor from a blood test?
Exactly. It's less invasive, potentially safer, and could give us even more detailed information.
Wow, that's incredible. So how does this connect with the biomarkers we've been talking about?
Well, think about it. What if we could combine blood tests for these protein biomarkers with the information we get from liquid biopsies?
We'd have this amazing two-pronged approach monitoring both the immune system and the tumor.
Like having a roadmap to navigate the complexities of cancer.
Guiding treatment decisions with so much more precision.
And it all starts with the blood test. It's amazing how much we can learn from a few drops of blood.
It really is. It shows you the power of science and the potential of personalized medicine.
And speaking of potential, I think it's time we talk about the limitations of this study and the need for further research before we wrap up.
Right. We don't want to get too far ahead of ourselves. This research is super exciting, but it's important to keep those limitations in mind.
Absolutely. We've talked about the size of the study, 75 patients. That's a decent start. But to be really sure about these findings, we need more research with bigger groups of people, right?
Yeah, for sure. And not just bigger groups, but more diverse groups, too. We need to make sure these biomarkers work for everyone.
Right, no matter their background or their individual situation.
Exactly.
And another thing, this study was all about patients with recurrent endometrial cancer.
Right.
So we need to figure out if those same biomarkers would be helpful for people who are newly diagnosed.
Yeah, that's a really good point. It might be different at different stages of the disease.
And even if it turns out these biomarkers are accurate and reliable, there's the whole question of how we actually put this knowledge to use for patients in the real world.
Absolutely. It's one thing to find these biomarkers in a research study, but it's another to make them useful for doctors and patients in everyday life.
Right. We need to develop tests that doctors can easily order and understand. And we need to figure out clear guidelines for how to use this information to make decisions about treatment.
Exactly. And that'll take a lot of teamwork. Scientists, doctors, policymakers, they all need to work together to make sure these advancements are used safely and effectively.
It's a big team effort to bring these discoveries from the lab to the people who need them.
It is. And there's the cost, too. These new treatments are probably going to be expensive.
Right.
And we have to make sure cost doesn't prevent people from getting the treatment they need.
It shouldn't be about how much money you have. Everyone deserves a chance to beat cancer.
Absolutely. We need policies that make sure everyone has access to quality health care no matter what.
It's a matter of basic fairness.
Yeah.
So this study is a really hopeful sign, but it also brings up some important questions about equality and access.
It does.
And, one thing we haven't talked about yet is, well, what about early detection? Could these biomarkers help with that?
Oh, that's a really interesting thought. If we could find these biomarkers before someone even has symptoms,
Yeah.
we might be able to catch endometrial cancer really early when it's easier to treat.
That would be huge, like stopping a problem before it even really starts.
Exactly. Early detection changes everything, and these biomarkers could be a big part of that.
It's definitely something to be hopeful about, something to push for more research on. So as we wrap up our deep dive today, I want to leave everyone with a few things to think about.
Okay.
First, personalized medicine is changing so fast. And discoveries like this one show just how close we're getting to a future where treatments are designed for each person.
It's a future where we can move away from those one-size-fits-all approaches and really focus on what each individual needs.
And second, everyone listening, you can be a part of making that future happen. Stay informed about new research, support policies that make healthcare more accessible, and get involved with organizations that are fighting cancer.
Even small actions can make a difference.
They really can. And finally, never lose hope. This research shows what's possible when brilliant people put their minds to solving tough problems.
It's a reminder that we're making progress, and if we keep working together, we can make a real difference in people's lives.
So thank you all for joining us for this deep dive into the world of personalized endometrial cancer treatment. We hope you learned something new today.
And as always, stay curious, stay informed, and keep asking questions.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.